numbers in the country rising at a rapid rate, President Cyril Ramaphosa has had a meeting with the National Coronavirus Command Council following several calls for tightened restrictions. So, should we have another tough lockdown? Well, to discuss this, we're joined by Professor Alex van den Heever from the Wits University School of Governments. Prof, give us an idea of what it's like to be in Gauteng's health facilities right now. What are you hearing from your peers on the ground?
It's incredibly difficult at this point in time, both in the private and the public sector. There are reports that I'm seeing from people on the sort of front lines in some of the major hospitals that show that it is dire. My problem is that the data that we're seeing doesn't always reflect the true situation. So the reported statistics, for instance, to the NICD, show that there are substantially fewer admitted patients in public facilities than private. And that just means that we don't have a clear picture from the reported position, but it is extremely dire. And with the private sector also essentially unable to accommodate all the patient load. So I think it's really very, very problematic at the moment.
If you were fortunate enough not to have to, if you could have go to a private facility and it was full, would you try and chance it and get down to that hospital and wait it out and sit with oxygen, or try and get some oxygen at home?
I think the option for a lot of people is that they are trying to find some sort of treatment option in a home setting, with people often trying to buy the sort of oxygen concentrators and oxygen tanks. But that's not in itself sufficient. You also need to be managed by a clinician, and some clinicians are doing that. They're essentially looking after people and making sure that there's a protocol for them. So hopefully, if you are in that setting, that you don't suddenly deteriorate and then need to be admitted. And I think that becomes the problem, is that there's a restriction on the sort of upward referral when you require it.
Is it too late for a hard lockdown?
I think so. The question is what people understand as a hard lockdown. I think that there is space for additional restrictions at this point, but I think that the president's absolutely correct in saying that we can't have a lockdown which involves destruction of the economy, because unfortunately in the South African setting, that also destroys many communities and people. So we have to manage the super spreading risks and focus the restrictions on those. And the question is whether we've got complete coverage over those particular risk areas. And I don't think that we have at this point. I think we've been very slow to zero in on the high risk settings and to regulate them properly. So on the one hand, we need to enforce the regulations we have, which is not always done. And then the second part is to consider some additional measures to deal with high-risk gatherings, particularly indoors where people are sitting without masks, such as pubs, shebeens, taxis, even if they have masks on, are at high risk if their windows are closed. Those kinds of things are very important, and we could consider restrictions there that don't harm the economy.
So you're looking at enforcement being upped, and certainly this weekend. What else would you like to have seen done better by the authorities?
Well, I think that schools are also a high-risk setting, but the question is really whether the schools are always following the protocols correctly as well. So on the one hand, if they're not, they are a high-risk setting, then if they can't be managed properly, then they do need to be closed for this high-risk period. And I think that is a potential area. In terms of properly enforcing regulations, I think that there's a high risk of anybody being in a taxi, and many people are still going to work, can't avoid using taxis. And if the windows are not open, then you're going to get infected if you're in that taxi for longer than a few minutes. So I think that those kinds of things are very important, because they involve no impact on the economy at all, and yet prevent transmission.
Prof, I mean, so many of the public members of the public, I think, have got compliance fatigue. This is the third time that they're being really pushed to follow all the protocols. How are the healthcare workers doing from a resilience point of view? Getting up in the morning, making sure that they're sterilizing, putting on their PPE, dealing with patients who are severely ill, giving them their phones to make sure that they can communicate with loved ones. They must be very tired.
Well, I think that firstly, a lot of frontline healthcare workers are vaccinated now, which I think is a huge relief to many. That doesn't mean they won't get infected and experience at least mild illness and potentially transmit the virus to their family members. And that is a remaining concern for them. But I think that it will remain some pressure on them. But I think in terms of the rest of the population, the virus doesn't care whether you're fatigued or not. So we're going through a period now where we're accelerating the vaccination campaign and we're in the peak of infections. It really isn't worth it putting your life at risk before you've been vaccinated. During this period, just stay the hell away from high-risk settings. We probably are about 3 to 4 months away of being in a better position, but it just isn't worth getting infected at this point in time. And I think that many people haven't quite sort of grasped that. And it really doesn't matter how fatigued you are. Hold on for this period and just protect yourself regardless of the restrictions.
I think so many people, Prof, feel invincible until they've actually had it. Thank you so much for joining us. You couldn't have put it in sterner terms and been more vociferous. Stay away from high-risk spreader events. It's the best protection you have. Professor Alex van den Heever from the Wits University School of Governance.